This presentation is brought to you on behalf of Retire Safe. My name is Tristan Bourgeois, and I will be discussing senior mental health in the COVID-19 pandemic. To give a rundown of this presentation, I will begin by talking about the impact of the pandemic on seniors, assisted living during the pandemic, loneliness, signs of mental health issues, mental health tips for seniors and their loved ones, and therapy. The pandemic has led to increased isolation, which often leads to loneliness, increased rates of anxiety and depression, a decrease in exercise with the closure of gyms or other physical activity centers or groups, a disrupted routine and transitional issues such as having to conform to new restrictions and regulations brought about from the pandemic, assisted living lockdowns, less self-reliance, having to rely on outside help for basic necessities such as groceries, unable to attend events or outings such as clubs, groups, or going out to eat, and even those that did not previously struggle with mental health might face difficulties during these times. I will now talk more about assisted living facilities during the pandemic. Since there are no federal regulations regarding assisted living, it is up to the state to put standards in place. This involves issues such as the response to testing positive for COVID, visiting restrictions, isolation, and protection of residents. There was an increase of no-contact visits across all assisted living facilities, and some still have these restrictions put in place. This leads to an obvious lack of face-to-face time with loved ones, and this can take a major toll on senior mental health. There was also a big decrease in staff, which can lead to potential issues with the quality of care. A survey conducted by the American Health Care Association and National Center for Assisted Living found that during the pandemic, more than half of assisted living facilities are experiencing staffing shortages, with 30% facing high-level shortages and fewer than 5% reporting that they are fully staffed. This could lead to staff not being as attentive to the residents. There has also been high COVID-19 rates, leading to high COVID-19 death rates and increased isolation. Due to nursing home residents being at a high risk for getting COVID-19, those that tested positive would be isolated or transferred to another facility for other resident safety. This would often contribute to loneliness and could cause confusion for them. I will now elaborate more on loneliness in seniors. Loneliness is a big issue for seniors and can lead to physical and mental issues. Seniors are already a highly isolated group in society. A report from the National Academies of Sciences, Engineering, and Medicine found that around 1/4 of adults 65 and older are socially isolated. With the pandemic forcing isolation, the issues of loneliness increases, especially for seniors. Loneliness can increase the risk of high blood pressure, heart disease, obesity, weakened immunity, mortality, anger, emotional distress, depression and anxiety, cognitive decline, dementia or Alzheimer's disease, and a study found that social isolation was associated with about a 50% increased risk for dementia. I will now talk about some potential signs of mental health issues. Noticeable changes in mood, energy level, or appetite, feeling flat or having trouble feeling positive emotions, difficulty sleeping or sleeping too much, difficulty concentrating, feeling restless or on edge, increased worry or feeling stressed, anger, irritability or aggressiveness, ongoing headaches, digestive issues or pain, a need for alcohol or drugs, sadness or hopelessness, suicidal thoughts, engaging in high-risk activities, obsessive thinking or compulsive behavior, thoughts or behaviors that interfere with work, family, or social life, unusual thinking or behaviors that concern other people. These are signs that you should look out for within yourself and your loved ones. Some mental health tips for seniors are use computers and smartphones to stay connected. If you have a loved one that's a senior, try to stay connected with them as well. Utilize telehealth and telemedicine. This gives you access to online healthcare, whether that be physical issues or mental issues, or access to medication. Create a routine. Since everyone's normal routine was disrupted, it's important to adapt and create a new routine to help with stability and consistency. Be sure to be eating well. Gut health and mental health are closely related, and it's important to take care of your physical body to help your mental state. Stay active. Go outside if possible. Not only can it boost your mood and help fight depression, it can help with strength, which can help with your independence, balance, which can help prevent falls, increase energy levels. It can help prevent or delay diseases such as diabetes and heart disease, and it can potentially improve cognitive function. It's also important to keep a consistent sleep cycle. With everyone's routines thrown off, it's easy to sleep too much or not enough. One way to help this would be picking up a hobby such as knitting, baking or cooking, reading, gardening, anything to help stimulate your mind in a healthy way. It's important to try to utilize the mental health tips that I just discussed, but sometimes you do need more support, and one option for that is therapy. Therapy is used to assist people with struggles they are facing. There are different types of issues that can arise specifically as you age. Change in environment or routine, such as moving living spaces, and general routine being disrupted from the pandemic. Dealing with a newly diagnosed illness or condition. Playing off of this, there are issues that can happen after having COVID and recovering. Dealing and accepting the fact of aging, being unable to do things you once could, more commonly having to deal with loss, isolation or loneliness, moving to a facility, being unable to drive, family or friends moving away. Therapists specialize in specific issues and age groups to better cater to your needs and goals. It's never too late for therapy. It's always an option and can always help you live a better and happier life no matter what age you are. Some things that I hope you take away from this presentation are that there's a strong link between mental and physical health. Be aware of mood changes with yourself or your loved ones. Don't be afraid to speak up about concerns you have about yourself or a loved one, and that mental health issues are common among seniors, especially during the pandemic. Thank you for listening to this presentation, and once again, this is brought to you by Retire Safe.